Okay, so this is our first discussion on topics that have to do halacha and pregnancy and childbirth. I'm Dr. Herman, Jonathan Herman. I'm sitting in New York. I'm just going to tell you 1 second about who I am, where I come from. I've been an OB/GYN since 1989. I did a residency and then went into private practice. Along the way, a few years ago, we calculated and I passed the 10,000 delivery mark. So now I must be up to 12 or 13,000 babies without really keeping a close count. I have a significant from and non-Jewish population that comes to my practice. I'm happy to say that I am delivering patients' children, and now I'm delivering those children that I delivered 20 years ago and 25 years ago, and it's one of the trophies that I have when I come home. I have a patient who's due in a week who, on top of her chart, said I delivered her, and I can't wait to deliver her baby. With that said, there isn't a day that goes by that we don't have challenges in our office, that we don't have halachic challenges and halachic discussions. And I'm hoping that what we're going to discuss is some of those issues that arise in my office. One of the things that drives me every day is that we must say Hodu LaHashem. We must understand that at every turn that we're not really in control. We're taught to do things, and it's God who teaches us to do those things, and we carry them out. And the second that we forget and think that it's our doing is when we really get into trouble. I just read recently that the word Leida is a very interesting word. Leida is giving birth, but Leida is Liyad Hashem. That it comes out, everything comes out from God's hand when it comes to birth. There are a number of things in Judaism where we believe that God himself comes with nobody else, but with his own doing. And one of those things is at the time of birth, when the neshama is given straight from God. And we remember that in the delivery room, he is our partner in making sure that things come out okay. With that said, that's my introduction, and I'm gonna turn it over now to Dr. Segelman.
Hello, my name is Segelman, Rabbi Segelman. I am currently living in Los Angeles, California, where I am the Rabbi of the Young Israel of Hancock Park. I am also the rabbinic director of PUAH, which is an organization which is worldwide, but I run the American office, an organization which is geared to helping couples navigate all questions of infertility and reproductive health. Many couples and individuals have questions related to reproduction and the interplay with halacha. Our organization was founded about 40 years ago when IVF kind of hit the field. And the mission of the organization was to help couples navigate through the challenges and not to allow or not to see halacha as an impediment, but rather how to celebrate both realities, how to celebrate medicine in conjunction with halacha, and to allow for the doors to be open as opposed to closing doors. And fast forward 40 years later, we are servicing the Jewish community with all different types of questions, whether it's related to childbirth, pregnancy, infertility, genetics, the like. And throughout the discussions that we'll have with Dr. Herman, you'll see a little bit of the questions that come in both to the doctor's desk as well as on the rabbi's desk. And I'd like to personally thank Dr. Herman for the partnership, and I cherish this opportunity to bring both worlds to the same Zoom meeting, to the same book, to the same table, to the same room, so we can really juxtapose both medicine and halacha in a very intelligent and an honest way, and see the beauty and the synthesis between medicine and halacha, and how both are God's constructs coming together in a very beautiful and harmonious way.
Amen. In general, what we're going to be doing is we're going to be talking about a specific topic, different points of view, different types of ideas. We're going to eventually open up the topic to all those who watch. They'll be able to submit questions. We'll take those questions, we'll correlate them, and then on a subsequent Zoom meeting, we will talk about those questions and try to get answers to things maybe that we didn't think of or we didn't have time to talk about on the day of that topic. With that said, our topics are going to include a number of different things. Today, we're going to talk a little bit about genetic testing before pregnancy, in pregnancy, and in fertility. We're going to talk eventually about birthing on Shabbos. We'll talk about fasting. We'll talk about Yom Kippur. We'll talk about induction of labor. We'll talk about halachic things that apply after birth. We'll talk about halachic things that apply to ultrasounds and abnormal ultrasounds and normal ultrasounds. And then I'm sure we're going to find topics that people suggest that we say, hey, that's a great idea, and we'll add those on as we go. So today we're going to start, again, 3 topics: carrier screening, genetic testing in pregnancy, and genetic testing in infertility. So genetic carrier screening. In every high school class, they teach about the Punnett square, the dominant genes and recessive genes. We all carry dominant genes and recessive genes. We all also probably carry abnormal dominant and recessive genes. Some of them are important to our life. Some of them will go unnoticed. Okay. During the course of time, we see recessive genes is what we're going to talk about today, where both partners, husband and wife, have to carry an abnormal gene for a child to have a 25% chance of having the disease. So being a carrier is not meaningful to life, but passing on a gene from the husband and wife to the child places the child at risk for specific diseases. And then those diseases, it's important to understand, could be expressed in different ways. What does that mean? For some people who carry both genes, they don't show relatively minor changes. And for some, it's a very major illness. And that has to be considered when we talk about these different entities. Going back, an unbelievable machon was created called Dar Yesharim, which is very prominent. It was started due to a family carrying genes for Tay-Sachs and unfortunately losing children to Tay-Sachs. And they made it their mission to test in the Jewish community anonymously. They test high school students and college students. And then when they start going out, they make sure that they don't share these very important genes, abnormalities. And if they do, they let them know. So that dating does not continue. Since they started, there have been more genes and more genes added. So now they test for a whole host of quote unquote Jewish genes. And that goes on. And my patients come in every day knowing that they've been tested for these very important genes. In my practice, and available commercially, is a test that includes them, plus a whole bunch of additionals. We have panels that test for 200 or more recessive genes. I'll call some of them minor genes, things that Dar Yesharim doesn't test for at this point. Why do I say that? Because I know, and I'm going to be involved in a meeting coming up with Dar Yesharim as they talk about how they're going to start including these minor genes and how they're going to work that into the way they test people. I can't wait to hear that discussion, as it interests me tremendously. On a very regular basis, patients come into my office and say, listen, I've been tested for Dar Yesharim. We were told we don't carry these genes in common, I said, I would like to test you for all the additional genes on the panel. And they say that's really not necessary because we know that we do not carry any of these very, very important genes. I tell them, and I give them an example. I tell them one of the most common gene abnormalities that a husband and wife could share is the gene for hearing loss. Not deafness, but hearing loss. And I'm going to tell you a story. The patient calls me up and says, the principal just called. My son is in 4th grade, and he said he's leaving my son back. And I told the principal, right, the parent tells the principal, but my son has been so smart. He's never had a problem in school. He says, yes, but your kid is failing, so he's got to repeat 4th grade. And he's made to repeat. He's in a grade with kids that are younger than him. The kids that he was friendly with are making fun of him because he's now left back. And a half a year later, they figure out the reason he failed was because he couldn't hear well. Not that he's deaf, but couldn't hear well. To that family, that is not called a minor gene. That minor gene has affected this child for the rest of his life. And if I asked them, we could have known this before. We could have known this before the child was born and then tested the child after he was born and been all over this. So the child, when he had problems hearing, would have had hearing aids and never would have been left back. Would that have been important to you? And they said, of course. Why didn't you force me to do this test? Why didn't you force me? I go, you told me you wouldn't do that. You wouldn't want the test. And I said, well, I told you how important this was. And you said, but we've already been tested. And that's a made up scenario that I just told you. It really happens. And in my office, I see that 1 in 300 from couples who come to me share quote unquote minor genes. So what I would like to know is a parent obligated to do this testing now? Should they be refusing? Should I be forcing them through discussion, telling them that it's important? A lot of them say, this stuff shouldn't be revealed to us. We shouldn't be looking for this. And I say, how can't you look? You need to take care of your child.
I think that I want to address, first of all, the amazing work that Dor Yesharim has done, as you alluded to, Rabbi Eckstein and his family, totally eradicating Tay-Sachs basically certainly from the Jewish world. But we also have to recognize that Dor Yesharim is a specific product and they have their mission. There are other products and that mission is not the same necessarily as Dor Yesharim. Dor Yesharim is an organization whose mission is to see to it that children will not be born with any major abnormalities, which are almost always non-compatible with life, but not always. They do, from what I understand, test for abnormalities which are compatible with life, but are severely burdensome. I think that's actually the word that they use. It is a tremendous burden.
And those we call the major genes.
The major ones.
The major ones.
And their mission is that shidduchim shouldn't be made. Marriages shouldn't be completed and you shouldn't enter a marriage knowing that of the real, as you said, 25% risk of bringing one of those children into the world. Now, it is completely anonymous. The couples will not know whether what they're carriers of and what they're not. They're told either they're compatible or non-compatible. If they're compatible, then they can get married. If they're not compatible, then they won't get married. But it does not mean that they are immune to illness. It doesn't mean that if you are compatible based on Dor Yesharim's conclusion, it doesn't mean that you are immune to any abnormality under the face of in this world. It's far from the truth. And I think that it's important to be specific here, how many tests they do test for and how many other organizations test for. I mean, we didn't say a finite number. I think you may have this information. Dor Yesharem's current panel, I think maybe it's less than 30.
I think it's in the 20 zone, but I'll get the exact number coming up.
Which is very significant compared to the 250 zone. You know, there's a major, you know, there really is a lot of room in between the two organizations. Let's say an organization, unknown organization, let's say the commercial, you know, or I don't know whether you want to use JScreen or other organizations that have
a patient shows up in my office and they're Jewish, but not affiliated. They're not from in any way. I offer them gene testing.
Right, which often they can get covered by insurance.
Which is most assuredly covered by insurance.
Right.
If you have insurance, we're getting it covered most every time.
Right.
Okay.
Now, let's say a couple says, I'll throw the question back to you. We want to do genetic testing.
Yep.
Doc, would you recommend us to call Dor Yesharem, or should we do the testing through you? I think the answer, I would like to hear your answer, but I think the answer may depend on what is this couple interested in? What answers are they looking for? Are they looking for the fact that they just want to know that they're compatible and that they're not carriers of the major genetic diseases? Or are they more interested in knowing that there's a whole slew of genetic abnormalities out there? We want to know if we're carriers, and we want to know what we are carriers for. What are those genes out there?
Well, I think also where they're up to in life. Are they now starting to go out? Are they going out seriously? Are they married? You know, we have people with 4 children who come to my practice, and it's the first time that they're at my practice. And I even did this going back, is if they were Dor Yesharem tested, then I didn't really put it to them, okay, you tested, you already have 4 children. My stance now is we still need to know about these other genes because it's still important. So I just want to actually talk about a couple of my cases. Familial Mediterranean fever is a common one.
Very common.
So I approach a family, you know, they're there, it's their first visit. I'm talking about all the different tests. And I said, one of the most common ones is familial Mediterranean fever. And the husband says, I have that. So I said to him, at what point in life did you find out you had it? He said, I think he was either 20 or 22 years old. And I said to him, I'm not really even sure all the symptoms of familial Mediterranean fever, but would it have changed your life had your parents known about this when you were born? He said, yes, it would have been a major advantage for me. And that's what propels me to, you know, to move ahead with it. And I brought my whole staff in to meet with this gentleman so he could tell them how important it was that people get tested. So certainly there's a dichotomy between should we, you know, go out, and I believe in, and I'm not sure, once someone's married, Dor Yesharem won't test them.
Correct.
Married, that's not their,
correct.
They're the reason why they exist.
Correct.
Okay. I also want to mention one other thing. It happened within the last 10 days in my office, although I know about it for a long time. A frum couple came in, and first baby, and they said, we had in vitro. I go, why do you have in vitro? They go, we both carry Tay-Sachs. So I said, really? When did you find out that you both carry Tay-Sachs? And they said, when we were dating. But we decided that we would continue dating and we would get married. And today we have the option to do in vitro. And we selected embryos. We made a whole bunch of embryos. We selected the ones that don't have Tay-Sachs. So, and then they're very, very happy with their decision, and now they're going to have a baby. I think it's important for people to know that we do have a workaround in case these situations do arise, okay? And it's not only a figment workaround, it's an actual employ today and available, that if we know of any gene abnormality, whether, because this becomes important to our discussion, whether important or quote unquote minor, you know, for that family, minor is never minor. and there is a workaround to make sure that their children are not born with those abnormalities. And secondly, if someone does have a minor abnormality, early detection could change the whole scenario, and all these tests are being done on behalf of the pediatrician, so the pediatrician could manage the baby before the baby gets into trouble. Okay, so going back to my question is, I have to know now, from a halachic point of view, how much pressure do I put on a patient to get tested? If someone comes in and goes, I'm Dory Shar, I'm tested, I don't need more testing, you know? And I have to say to them, I disagree with you. You did what you were supposed to do then, but now you have to protect your children. And if a patient says no to me, is there a halachic view that they really should be tested? Or for some people, they say, listen, we don't need to expose ourselves for things that are hidden. And right now, this is hidden within halacha. There's a concept, and I'm going to ask you about that concept of revealing things that are hidden. And we'll just dive in that everything's okay. And like I said, in my office, about 1 in 300 couples share abnormal genes.
Yeah. We know Chazal tell us that the rabbis teach us that shivim panim laTorah. There are 70 faces for Torah. So nothing that I can say is the unequivocal halachic response, which checks all boxes and which caters to every community. So what I would like to do is we will discuss on a halachic level, on a halachic perspective, some of the various opinions out there. But I think that it's important to throw out just a disclaimer that people should feel comfortable conversing with their own personal rabbanim, the people that they have relationships with, their rabbis. But I would like to take this opportunity to share some of the rabbinic literature and some of the rabbinic approach to the conversation, to enlighten the listenership and they can empower them to take this conversation home with them and to discuss it with their families and with their rabbis.
So this is a concept that will go on through all of our discussions.
Yeah.
We're talking about halachic concepts. We're not talking about strict halacha.
Good.
We'll repeat that again and again and again as we go. We're all very aware of that.
Good. Genetics is definitely something that the rabbis of the Talmud were aware of. There are a few examples in the Gemara where genetics comes up. It might not be directly saying the header genetics, but it's clear that that's the driving ingredient behind the specific sugya. I'll give you an example. The Gemara in Yevamis and Daf Samach Daled, which is 64. The Gemara in Yevamis discusses a family that had a baby who died after the Milah. Okay, so they performed the bris milah and the baby died. They had another baby. They performed the milah. The baby died. The Gemara now has a question. The third baby boy is born. The fourth baby boy is born, and the question is, what do we do with that baby? Do we perform the bris milah, knowing that this family, right, has a history of babies dying after the milah, or do we not? Right? It's slipping my mind. What's the genetic abnormality?
Hemophilia.
Hemophilia. So it's the Gemara doesn't say, Rashi doesn't say hemophilia, but to the reader it's obvious. We're dealing with a family that has hemophilia, and the children are dying after the bris. And there's a question of the Gemara: do we stop at the third baby? Do we need the third baby to die in order to not do the fourth? But the Gemara has a line that says, at a certain point, we don't do the bris. Why? Because achayos mechazkos. The truth is, it's talking about different families. That's why I remember the Gemara. It's talking about different families. And this family had a baby, and the baby died. This sister had a baby, the baby died. This sister had a baby. So we know achayos, the sister is mechazkos. There's a chazaka that there's a familial illness or abnormality in the family, right? I.e. hemophilia, that is preventing these children from living after the milah. And the Gemara says at a certain point, we have to stop that, because we don't know for sure, but history tells us, genetics tells us that there is a major concern for this child dying after the bris. There's a Gemara in Bechoros, a very interesting Gemara in Bechoros on Daf Mem Hey, on 45. And Bechoros talks about certain people not marrying because the children may be abnormal. Two people who are abnormally tall shouldn't marry lest the child is a giant. Two people who are abnormally short shouldn't marry because the child will be abnormally short. People who are abnormally white in pigment and vice versa shouldn't marry lest the child have some type of abnormality. So again, Bechoros Mem Hey, another instance, another example where the Gemara was sensitive to the fact that the husband comes in with his medical history when we introduce the wife's medical history, and the union, which will produce children, may incorporate both of those abnormalities and give that to the next generation, which would endanger the next generation. And following this all the way to the Shulchan Aruch in the beginning of Even HaEzer, the Gemara actually says that one should not marry into a family which is mishpachas hanichvin. We can translate that as a family of epilepsy. If there is epilepsy in the family, the Shulchan Aruch tells us, don't get involved in such a shidduch. Don't get married to such a family. Why? Because we know that this is going to impact the children. And that concern was the driving concern and main opposition that Dor Yesharim faced when Rabbi Eckstein was seeking rabbinic approbation, or seeking blessings from the rabbis before he began his organization. There was a major rabbinic opposition, because how could you have an organization which would reveal all of these abnormalities to the community, thereby putting everyone at a disadvantage and not allowing people to marry into those families? Because once we know that they have an abnormality, we are obligated to stay away from such a shidduch. Now, fast forward many years of arguments and debate and fine-tuning the organization, Rav Moshe gave his haskama to Dor Yesharim under certain conditions. And one of the conditions was that it would be absolutely anonymous, so that no one would be able to know someone else's results, lest they misunderstand someone who's positive for a carrier of Tay-Sachs being a problem of mishpachas hanichvin. Now, you and I, and hopefully many of us, the listeners, understand, as you said before, Dr. Herman, that being a carrier for Tay-Sachs is insignificant. Right? It will only express itself when the other partner is a carrier as well. But to the naked eye, certainly Rav Moshe was concerned that the people of his generation, if someone were to hear that Ruvain was a carrier of Tay-Sachs, although independently insignificant, but that would be an impediment and it would prevent him from being successful in shidduchim and getting married. So it's important to realize that genetics is not a concept which is foreign to Halacha. Halacha is very familiar with genetics and is actually very concerned for the future of Klal Yisrael, that genetics will create a disadvantage and will prevent people from getting married. That being said, we also have a mitzvah to be healthy. Right. We have a mitzvah to be healthy, and we have a mitzvah to bring, well, I don't know if a clear-cut mitzvah to bring healthy children into the world, but there's certainly an expectation that our children, that when we procreate and we continue the generations, we are continuing healthy generations and not sick and abnormal generations.
So I just want to point this out. So we talk about the major gene abnormalities, and we just as examples, we take those that have been identified by Dor Yesharim, those that get tested before going out. I see that clearly, and we have to be very careful, and I've thought about this a lot, about doing the extended panel before people are married. So I am known to say the best time to get that extended panel. Remember, we already understand your Dor Yesharim negative. You don't care.
You're compatible.
Compatible.
Okay.
Okay. You get the extended panel on the way to your first Shavar Bracha. Okay, you're married, before you have children, you get the extended panel. And I very much worry that with these minor genes, the hearing deficit gene, the familial Mediterranean gene as examples, that if a couple knows before they get married that their parents are going to intervene and make sure that shidduch doesn't go forward. So it's a very big achrayus in my heart to test the minute they're married, but not before, for that reason, because as minor genes, no one, in my opinion, and that's my opinion, should make a mistake and break up a shidduch in order to avoid both of them having it. And I'm not talking about carrying an abnormal gene. I'm talking about both of them carrying the abnormal gene.
So what could be a halachic opposition to your approach?
I'm not sure, but so many patients come in said we're declining testing because we know that we're already compatible.
Right. There is a pasuk in the Torah, Tamim tiem Hashem lokecha. The pasuk in Dvarim Yudches. So it's Dvarim 18:13 Yudches Yud Gimel. Tamim tiem Hashem lokecha. Now, Tamim tiem Hashem lokecha, we would translate it, you should be whole. Walk holy, be wholesome with your relationship with HaKadosh Baruch Hu. And the way Chazal, the rabbis, have interpreted this pasuk is that we shouldn't be, as Rashi says, we shouldn't be looking to find out the future and do heebie-jeebie things. I think that's an official term. Heebie-jeebie things to try to figure out what the future will bring, but rather have a holistic approach with HaKadosh Baruch Hu, have emunah in HaKadosh Baruch Hu, recognize that He runs the world, and don't try to outsmart God. Recognize that He runs the world and He will take care of you. So the fundamental question is, carrier screening, is that a violation of Tamim Tiem Hashem Elokecha? And this was a major debate when Dor Yesharim first hit the scene. And finally, after, it wasn't in the beginning, but after some time in development, Rav Moshe concluded in his psak, this is in Igros Moshe, that Tamim Tiem Hashem Elokecha does not apply in the following case. If you were to close your eyes and cross a busy street, right? You're in Lawrence. So to cross 878 and to close your eyes and cross 878 and say, God will protect me, is nothing short of stupidity, right? And negligence. A person is supposed to have emunah and supposed to be one with HaKadosh Baruch Hu. So Rav Moshe says something which is obviously dangerous, and B, something which is so easy to discover, an issue which is so easy to discover. So closing your eyes and turning your back from that reality is not a violation of Tamim Tiem, or is not an expectation of Tamim Tiem Hashem Elokecha, but rather negligence and stupidity. So the balance between, I'm going to get married, and I may be a carrier for Tay-Sachs, my wife may be a carrier for Tay-Sachs, but we're not going to test because God is going to take care of us. That, Rav Moshe writes, in this context is wrong. And it is not a violation of Tamim Tiem Hashem Elokecha. On the contrary, it is the basic hishtadlus. It is our basic, is the basic expectation of creating healthy generations. The question becomes much more gray when we're dealing with the minor abnormalities. What is the attitude? What is the halachic attitude towards the minor abnormalities, which are not objectively life-changing? Of course, as you said before, to that family, it's life-changing. And I once remember knocking on a pediatrician's door on Shabbos, and there was some issue with one of my children. So I interrupted his Shabbos meal, and he dealt with whatever pediatric issue there was. And at the end of the meal, at the end of our conversation, I apologized, and I said, just for future reference, I may have been a new father at the time, and I said, is this a type of medical emergency which warranted knocking on the pediatrician's door and disrupting his Shabbos afternoon with his family? And he said, I can't answer you. He said, if you were to ask me, no. But how could you tell a parent that your issue, your son's issue, or your daughter's issue is not a real issue? Every parent, when they're thinking about their child and their specific issue, to that parent, I'm going to do whatever it takes. I'm going to go to this doctor and that doctor, regardless of what they're up to in their Shabbos afternoon, their nap or their meal. So when it comes to your family, our personal families, we have a different perspective. But there is a difference between major and minor. There is a difference between an abnormality which is not compatible with life and something which will create certain inconveniences with life, but it's fully compatible with life, and the child can live and grow up to be a quote unquote healthy adult. That is a debate amongst the poskim. I know that there are certain rabbis, I think it's actually public, of Shmuel First from Chicago, publicly said that one should not be engaging in all these tests and over-testing and going beyond what Dor Yesharm has agreed upon to allow in their panel. I think I heard him say this, he was actually disappointed when Dor Yesharm began to expand their panel. The current panel now is an expanded panel of what it used to be. So you're Dr. Herman, you're saying that they're considering even expanding it further. Historically, it was always very, very limited in scope. Whereas take an organization like JScreen or any of the other commercial, just going through the hospital, going through your insurance, you have an amazing amount of tests available. The issue, and I think you alluded to this before, over testing, a lot of these things, we don't even know what to do with them. We don't even know what to do with our results. That is the question of Tamim Tiyam Hashem Elokecha. And I think what it boils down to is each and every couple has to be comfortable with their position. If they are a couple that live a life that they are really, and I'm talking about a genuine level of emunah, a genuine level of a comfort that they have with HaKadosh Baruch Hu, knowing that Hashem takes care of them on their level. If they feel uncomfortable going for the minor panel because they really do feel that they're stepping into God's territory, I respect that. For other couples, and there are rabbis for them to hang their hat on, 100%. Other rabbis speak more of the findings of modern medicine and modern science, and how we always embrace modern science, and how we're always looking to incorporate the newest and the latest into our daily lives. That's true with technology, it's true with medicine, it's true with so many areas of life, and that is their mentality. That I'm not saying that is anti-religion. They certainly exist in conjunction with their emunah and HaKadosh Baruch Hu, but there is more room for the sciences and new findings. If that is less consistent with their lifestyle, I too would encourage them to consider that further panel, because better safe than sorry. Sometimes we look at it from the other perspective. Is the couple going to be down on themselves? How could I not have tested? And they're going to feel guilt and they're going to be upset at themselves? Or are they is that going to be a tool where they're actually going to use to strengthen their emunah and HaKadosh Baruch Hu? This is a God-sent nisayon. Those are two very different responses, two different families. Both can be completely accurate and appropriate and religious, but they're different. And different couples should be given different advice.
And I think I could accept everything that you just said, but the idea is they have to understand what they're doing. A blanket, I'm not testing because we are compatible, to me personally is not acceptable. After an explanation and seeing that they understand what we're talking about, then they have every right to either test or not test. Right. And that's where I come from.
Right.
Awesome. It's now 3:50. Right, so we didn't know how long that was last. I thought it was 15 minutes, but much longer. Do we want to go in or start doing genetic testing in pregnancy, talking about Down syndrome? Or do we cut it off today and, do you want
to talk about BRCA? I think BRCA is very important. Do you have a class, do you have a session all,
We will, but I wanted to keep it more to pregnancy and so on. And again,
we can do pregnancy now. If you have time, I have time. If you want to knock it out.
Okay, so we're gonna stop, and we're not gonna do genetic testing in fertility, because that surely is gonna be a very long discussion and a highly interesting one. Genetic testing in pregnancy. When I say that, really what that means to me is talking about Down syndrome and Down syndrome testing. Now, every time someone gets pregnant, they're at risk for Down syndrome. What I mean at risk, and the truth is either the baby it has Down syndrome or it doesn't have Down syndrome. But I'm saying that story, every story has a risk until we know how it comes out. And as it turns out, a lot of those risk models are based on age. So a woman who's 23 years old and pregnant, her risk probably is 1 in 1,700 to 1 in 2,000. A patient who's 35 years old, her risk is 1 in 350. You see it goes up with age. A woman who's 40 years old, her risk is 1 in 100. Okay, and there's a table that shows you these risks. So anybody who walks into my office, until we know better, that's their risk number. You're 35, 1 in 350. 40, 1 in 100. So I approach them and I'd say, how much more would you like to know? And classically, we did testing. And based on those tests, we would recommend an amniocentesis, where we would take fluid from around the baby, grow the cells, and find out, does this baby have Down syndrome or not? That went along with a risk of losing the pregnancy. And we could talk about what that risk is, and they've gotten better and better at doing these tests, so the risks have gone down. But you could lose a pregnancy. So I think that starting off, we had a very big resistance to doing amnio because you're risking losing a baby for what purpose, right? If you have a Down syndrome in the frum world, most people overwhelmingly continue being pregnant. We could talk about that a little bit. But today there's new testing or screening that we have in the last few years called NIPT. Non-invasive prenatal testing. There's no invasion, there's no needle into the womb. There's a blood test of the mother after 10 weeks. And in that blood from the mother, there are pieces of DNA from the placenta, and that could be multiplied thousands and thousands of times, and they could figure out the ratio of chromosome that the baby has, and could pretty well predict whether the baby has Down syndrome or not, independent of age. And that test will result basically with the concept of this. The woman who's 40 years old and her chance is 1 in 100. The woman who's 35 and her chance is 1 in 350. Do the blood test, and the blood test will say your chance now is 1 in 10,000, and they're very happy with that. Or, God forbid, 1 in 3. Patients come all the time, they're offered the test, and I always tell them this is a discussion for the Shabbos table that goes on forever. Should they do the test, yes or no? Right? Should a patient who's 20 years old, whose chance is about 1 in 1,900, 1 in 2,000 do it? The truth is there's not much advantage to her. So overwhelming, the 20-year-old doesn't do the test. But when you get to 35, and your chance is 1 in 350, and your friend just had a Down syndrome baby, the discussion is this some information that you would like to know now? Or would you like to know the information when the baby comes out? Or should we wait till you get the big ultrasound and see what that big ultrasound tells us before consider getting testing or not? And it's my little joke that I say the accountants, the actuaries, they like to get tested. Neonatal nurses always get tested. And then we look at what happens in families. If someone comes to us from a family that there's a lot of times they would like to get tested. I just want to throw in one more story for consideration. A very dear patient of mine gave birth to a Down syndrome baby. And then she recently came back pregnant. And I asked her, would you like to have Down syndrome testing? And she looked at me and said one word, why? For her, it's not a consideration. For somebody else, it is their major consideration. So from the point of halacha, is there any reason that they shouldn't be tested? Are there reasons that they should be tested? And how does halacha view this very new way to test? We do realize and we do recognize that when a patient does come back positive and their chance is very high to have Down syndrome, that they do change the way in their view of how they would act from what they thought before they had the test done. And there are a lot of shilas that come up. Should they have an amnio? If it's a Down syndrome, could they decide not to continue being pregnant? So always with the recommendations of these tests, we have to be very careful.
Yeah.
Tough.
What are you gonna say?
Tough. It's a very tough
question.
Tough question.
I remember when I was a young Kolel Avrech, and my wife, for full disclosure, was a patient of Dr. Herman. She was scheduled to have the 20-week ultrasound. I think it was probably our first pregnancy.
Before you go ahead, I don't remember this story, just so you
know. No. It's a story with me. It wasn't relevant to you.
Yeah.
So I had to ask permission from the Rosh Kollel to leave yeshiva to join my wife at the 20-week sonogram, because it was during the day and I was scheduled to be in yeshiva. So to leave, you had to ask permission. So I asked the Rosh Kollel, and again, I was a young, new, naive father. My wife tells me, my wife is very smart. She tells me that all husbands come to the 20-week sonogram. So I'm not going to be different than any other husband. So I go and I ask Rishus, I ask permission from the Rosh Kollel if I could leave yeshiva. And he says no. So I said, you're not going to let me leave yeshiva to go to my wife's 20-week sonogram? This is the big sonogram. So he says, why is this sonogram different than any other sonogram? What's the difference? Whether you get good news, bad news, mediocre news, any news, nothing is going to change. So why should you go? I subsequently fought with him and told him if nothing but my wife's emotional well-being, which should be enough to let me go. And he did let me go. His approach was that no result that you could ever get during a pregnancy would justify the termination or ending a pregnancy, in which case there's no reason to terminate, to go to the appointment or to test. Now, that is one extreme. And I think that you and I together, as well as the listenership and the readership of this future book, will have personal stories or have heard stories about the importance of testing from an emotional perspective as well as a halachic perspective. We'll hopefully discuss in later sessions the termination of a pregnancy. And there are rabbis, reputable, orthodox, halachic decisors and authorities, mainstream authorities, who will permit an abortion, a termination, even for a Down syndrome child. That psak, that ruling, should not exist independent or in a vacuum, but that halachic ruling for a specific family could be very important. If we're dealing with a specific family that has a number of children already, and their emotion and the mental health is an issue, and this is going to add to that, and it will be extremely destructive. So that may be that's a very different discussion than a young couple who, when they hear the news of their first child is Down syndrome, it may be a very, very different, a very different discussion and a different psak and a different, different attitude. But I think it is important to put it out there that there are authorities, and I'm not endorsing any which way, but there are authorities that do permit for a termination of a Down syndrome child under certain circumstances, in which case it's important to recognize that each couple is different, and it could be for that couple, that's a very significant and important psak. From a medical standpoint, let's assume this couple, I remember I once had a question, a shaila that came in from a couple that actually had a Down syndrome child. Then they used an IUD to get to as contraception. And she called me because she was pregnant with the IUD. She got pregnant despite the fact that she had the IUD. And it was shortly after her Down syndrome child was born. And she was literally, drowning in services and trying to get this child afloat. And she calls me that she's pregnant and she's crying. And I tried to allude to the fact that there are rabbanim that we can talk to. We can have this conversation about terminating. It's, let's just get it out there. And when she picked up on the fact that I was even hinting to the possibility of terminating the pregnancy, she got angry with me. How dare you bring that up? How dare you? Of course I'm not going to terminate. How dare you bring that up? And I thought, meanwhile, my naive self, I thought that was the reason why she was calling. So people have very different perspectives on life, on terminating, on pregnancy. But it's important to know that the concept exists. But let's say that you're not going to terminate at all. I'll throw the ball back in your court. Would you deliver? Would you treat the pregnancy different from a medical perspective, from being this woman's physician, her OBGYN? Would you screen her, cater to her in any medical need, and or deliver the baby any differently, knowing that it's a Down syndrome baby? I think that I don't want to encroach onto your territory, but knowing that there are certain common issues, heart issues that come along with Down syndrome, which are significant for the physician to be aware of, that in and of itself, let's say you want to keep the pregnancy, but let's be informed of what we're dealing with so that we're able to bring this baby to life in the healthiest and most responsible way. So even from a halachic perspective, if you want to keep the pregnancy, because halacha would want you to keep the pregnancy, let's say, but even from a halachic perspective, there's also an expectation that you do everything in the most healthy and medically responsible way. So maybe that information is halachically significant to see to it that we can continue the pregnancy and deliver in the most healthy fashion. And I'll conclude with the emotional element. There are two different types of people. I'm sure there are more than that, but there are people who don't want to hear of anything. And when the issue is an issue, then I'll deal with it. My wife, for instance, is the opposite. She needs to know in advance. She needs to prepare. She needs to be well equipped for that day to come. Now, that day may be in 7 months from now, but I need to know now. When my wife finds out that she's pregnant, if it's around Pesach time, she'll start calling cousins. Where are you for Pesach? Where are you for Pesach? Because I might go into labor and I want to know that you're a backup. And they look at her like she's crazy. We haven't even celebrated Sukkot yet, and you're calling me about Pesach. That's her personality. I think that type of personality will be at ease. Will be able to rest assured knowing that it is in fact a Down syndrome, but I now have 7 months to prepare for this baby, as opposed to sitting on shpilkas. See how we translate that, but sitting on shpilkas till the end of this pregnancy, knowing or not knowing what my delivery day will bring.
I think what you just said is my everyday at work. It's my everyday trying to figure out who the people are who are sitting in front of me. And I have a saying now, it's very hard to figure it out because everybody shops at the same shaitel store. So you can't just look at somebody you really have to speak with them. And I get responses are, we don't do that type of testing. And I asked them exactly who the we are. And they said, my Rav doesn't want me to do that testing. And I said, did you really speak to your Rav about this? Or are you just saying my Rav doesn't want to do testing? I go, this is a test for you and for your husband. So we could take care of you better, but you have to guide me on which person you are. Are you on the side that I'd rather not know, and when I need to deal with it, I'll deal with it? or I want to know everything that could be known. Okay. And
I would argue that when you say, what does your Rav say about this? I hope I'm not disrespecting any Rabbanim, but I wonder whether Rabbanim are informed of, and this is kind of what I want to throw back into your court, the medical concerns and the medical care during the pregnancy and during the delivery. If there is a difference, Rabbanim should know that, because I think that would have a major impact on their halachic decision whether to test or not.
I think a lot of them, and again, I don't know, but I think a lot of them are defaulting back to the day of amnio and saying you're risking losing the baby, so you can't take that. Halachically, you can't take that risk. But here, that risk has been removed now. It is we're good?
Yeah.
Okay. We've removed that risk, but I think, again, technology has advanced further than the discussion that we need to have. One other idea and concept, and I am very strong in my statements about this. I don't care which doctor you use. Of course, listen, I make my parnasa. Everybody uses it. I don't care which doctor you use, but everything we've talked about has to involve doctors that have some concept or respect for halacha. I know of non-Jewish doctors in Manhattan are so well respected for their appreciation of halacha that it's unbelievable. And two is, I work with maternal fetal medicine at my hospital. And when I started, they didn't have such appreciation for halacha. But I'm telling you, the chief of maternal fetal medicine, when we find a significant abnormality, the first thing he tells me, do you want me to get on the phone with their Rav? He knows now that in our decision-making, we're incorporating the patient, her husband, the Rav, and me and him in these discussions. And I see so many times in the hospital that the frum patient comes in, and I'm going, what is that patient doing with that doctor? That doctor has no concept or appreciation or even the ability to ask, we need to, how do we involve the Rav, in this type of discussion? The nurses in the hospital now appreciate when a patient comes in and we have a recommendation of a treatment plan, that the patient says, do you mind if we wait a half an hour because I need to speak to my Rav and hear what my Rav says? And as you know, I have, again, my personal hashkafa is I don't look at a particular Rav. I go to the patient's Rav, is the Rav that I need to speak to, and we must be willing to do that. And I think this is a perfect case to involve a Rav in either before or after this testing, and they should have the point of view from the Rav. But I think that this testing has, again, we've evolved in testing to remove the sakana part, the amnio risk of losing the baby, but our thinking still is stuck with, Down syndrome testing, that means there's a sakana to the baby and losing a baby.
When you go into the delivery room to deliver a baby with Down syndrome, do you deliver the baby differently knowing that he has Down syndrome or she has Down syndrome than if you knew that all the tests came out conclusively not Down syndrome? Is there any difference in your approach? Is there a difference? Is there vaginal versus C-section? Anything that you do differently, knowing versus not knowing?
Yes, there is. For the most part. Again, we talked about cardiac defects, and they can be quite severe. And we know the baby's going to have 3, 4, and 5 heart surgeries, and this is going to be go on for years and years. And we don't know the mental capabilities of the Down syndrome. They could be the greatest kid in the world, and I go to shul and I sit next to this boy with Down syndrome, and you just want to hug him, and he's the sweetest kid in the world. And there are also Down syndrome babies that grow up and never leave the hospital because they're so sick. So again, we try to determine as best as we can which one it is. But the first difference and the first change in the way I take care of somebody is saying, I would like to induce you so I could sit with you. And we want to do that not on a Sunday and not on a holiday. I want to do it when we have everything in place for this baby that we could have. Because our job is to maximize, the outcome within what we're given. You're given a set of cards, you have to play them properly. And for sure, I want to play them the best as I can. We do have stories of babies that were unexpectedly delivered on a Friday night when I happened not to be there, when someone else was there. The patient couldn't call their family. It was, I think, a first baby or a second baby in the family. They're faced with this Down syndrome baby. They can't call their Rav for advice. They can't call their family for advice. And basically, there was no one there to give them advice. And I think that really had a negative impact, going forward, and probably still to today, on that family and on that child. So I do change what I do, but I also grant you, many people know how to take care of these babies, how to live with these babies. I gave you my personal way and my personal change in how I take care of them.
In your experience, is there ever a need for an immediate medical intervention after the baby is born, an emergency cardiovascular surgery or something along those lines? Or is all of the medical care subsequent, but not necessarily immediate?
That's 99.9 is non-immediate. The one, that 0.1%, I'm just making up numbers, that need that care, I, again, have to make sure that it's in place. And one of the things I pride myself on is taking a patient. Some of the best deliveries I do are the ones that I don't do. And I figure out what hospital that particular baby needs to be in. I've sent people to Philadelphia to CHOP. I send people to Manhattan. And there are other people that I say, listen, you don't need to do that. We have all the resources that we need are here right now. And that is, again, the minor subset of the subset. But as we know, all those cases really exist, and they really exist in my office.
I think it's important because that could theoretically change significantly a Rav's approach to testing, knowing that there are real life, real physical and real technical changes of medical care based on the information. So it's not just that this information is irrelevant and superfluous because nothing's going to change. No, it's significant. It's necessary. It's relevant. Changes will be made based on it. I think that is, in my opinion, one of the most important items that Rabbanim should be aware of before advising, guiding, and supporting their couples with these questions when the couples come to them. The Rabbanim have a responsibility to be well-versed in not just the hashkafa behind it, but the medical reality as well, to allow them to shape their hashkafa, because the two really go hand in hand.
Which I think breaks it down into the two groups, the group that tests before the big ultrasound and the group that tests based on that big ultrasound. I think most Rabbanim, in my experience, if there's a significant finding on the big ultrasound, do not say that they shouldn't test. I don't know if they encourage them to test, but certainly would agree with testing. The bigger issue and the bigger discussion is the 10-week when everything is going fine and everything looks as perfect as can be, doing the testing at that point. And again, today we remove the sakana from that testing. So I think that needs to be a reevaluation of what we tell the patient, and how we figure out and how we advise the patient whether they should test or not. Right now, I think most of that testing is being done based on age. Your chance is much higher if you're 42 years old than when it's 22 years old. But we also recognize, again, like I mentioned, the person who comes to you and says, well, my sister just had a Down syndrome baby. She's 28 years old. I'm 27 right now, and I would like to get tested.
Right. Again, this discussion is a Down syndrome discussion. Down syndrome, for the most part, is absolutely compatible with life. When we deal with things, when we have findings of trisomy 13 and trisomy 18, which is less compatible with life. So the question is, how does that alter the conversation? And what would the halachic approach be when we're dealing with a trisomy 13 and not a Down syndrome?
Okay, so taking a step back, the NIPT test can pick up most of the Down syndrome, most of what you just mentioned, those that are not compatible with life, specifically those two, but also picks up what we call the sex chromosomes. And this is a big problem for testing. The patient would like to know what gender they have, and it will report gender. But one of the most common genetic findings is the abnormal, whether there's an extra X chromosome or Y chromosome, very compatible with life.
Sure.
Very compatible.
So compatible with fertility.
Yes, but incompatible with fertility. In other words, their child may be born and might not be able to have children, but will live a long and happy life. In fact, and that specifically, we'll talk about Klinefelters. I have a number of men who've come to me from men married who are having problems getting pregnant, who I discover or we discover carry Klinefelters. And the reason they're not getting pregnant is from the time of conception, they grew up not having sperm that they could use to help conceive. And what happens to that patient when you find that out based on a test you were really doing for Down syndrome is now reported to them that they have a baby that has Klinefelters, which is common. Another one is XO, Turner syndrome, okay, where I have a number of grown patients with Turner syndrome and they don't generally have children. Then again, we have to turn to Rabbanim, and what does that mean on behalf of these patients, either remaining pregnant or does that affect actually getting the test to begin with?
I would imagine that you have a medical responsibility, an ethical responsibility to provide all the findings. Although if a couple says, we want to know if it's a boy or a girl, we want to know if it has Down syndrome. I don't want to hear about Turner syndrome. I don't want to hear about Klinefelter syndrome. I don't want to hear about Edgar. I don't want to hear about it. I just want to hear about Down syndrome, male, female. Are you ethically able to provide that information and purposely withhold other info, knowing that this child is a Klinefelter patient?
I don't know. And we've always taken the tack that is revealed to the patient. A patient could ask not to know the gender of the baby, right? And we don't even ask what the gender of the baby is based on the test, but we will get back normal sex chromosomes. So we don't know if it's a boy or a girl, but we'll know it's normal. But they'll also report back to us abnormal sex chromosomes. And we've had numerous patients who've had them because it is common. And we've discussed with them, and most of them do remain, pregnant. We did have a non-from patient recently who terminated a pregnancy based on that. I think that was
Klinefelter or Turner?
Turner, which we weren't happy with.
Yeah.
But that's not our choice. The patient has a right under the law to do that. I don't have to do the termination. I don't do those terminations. Someone else did, but it was our patient who was, based on this test, got that result. And again, we have to be very careful, when doing these tests because of those ramifications.
As Dr. Herman pointed out earlier, when in the Tay-Sachs discussion, that fertility treatment can address the fact that two patients can be carriers of the same genetic illness, and using technology like PGD, pre-implantation genetic diagnosis, choose healthy embryos and discard unhealthy embryos. There are also medical interventions that can help patients with Klinefelter or Turner syndrome if they physically don't produce sperm, like a Klinefelter's case or a Turner syndrome case. Not all cases, but in most of them, there are third-party third-party reproduction does allow for the Klinefelter patient to utilize donor sperm, for the Turner patient to utilize egg donation, which I am excited to have a different discussion with you about sperm donation and egg donation. But it's important to know that number one, as you said, they're absolutely compatible with life. I know personally, as I'm sure you do, wonderful young men and women who have Turner syndrome and Klinefelter syndrome, who are successful, wonderful people, major contributions to the Jewish community. And that's in terms of their own being, their existence. And in terms of the fertility, there are halachic, we can have the halachic discussion and the medical discussion, but there are avenues that these patients, these couples, these individuals can address their fertility concern, their infertility concern, and have children. I know women who have Turner syndrome who are mothers. I know Klinefelter syndrome who patients who are fathers. They're not the biological fathers, but they are the father of the house with children. And that's something which I think when we talk about termination is very, very different than Down syndrome, very different than Down syndrome. And it's not in the same category at all. And I have yet to find any posek that would allow for termination because of Klinefelter or Turner syndrome.